The only issue I really had, I had a headache for 4 days. On Saturday, Sunday, Monday, Tuesday.
Okay.
I called on Monday. The nurse I talked to just said that it was probably just a migraine. But the reason why I called, because it, wouldn't go away, but then I started getting a shooting pain behind my eye.
So that should have prompted you to go to the emergency room. Okay,
Okay.
that's not a pregnancy-related problem. Do you know with whom you spoke when you called on Monday?
I don't remember her name. No.
Okay, so I'll talk to my front office staff, but you should always, headaches are very, especially migraines are very rare in pregnancy, just because the hormones are really usually at a calm level. So if it's something that's distinct to you and it's the worst headache you've ever had and it's not going away, and then you have a pain behind your eye, those are all worrisome things to me.
Okay.
Okay.
Well, I've never had a migraine. She said that they were common in pregnancy, so.
Do you remember? You don't remember with
I
whom you
don't
spoke?
remember.
Okay.
No. So it was Monday.
Monday.
Around 10-ish or so.
Okay.
Yeah.
I'll try and figure that out, but that's misinformation, so I apologize. Whenever you're worried.
It went away, so.
Yeah.
I told her if it didn't go away, I would go to the urgent care or something.
Okay.
So.
So again, we did our general survey. Violet, there's her bladder.
Okay.
Baby's kind of transverse. Placenta is posterior, not a previa. Baby's alive. And there we go. So now we can get started. So here's the baby's face. You see a little hand up here. So here's a thumb and a bunch of fingers. The baby's hand is open. There's a chromosomal defect called trisomy 18. Those babies, their hands are always clenched like this with the thumb overriding the finger. They never open up their hands. So when I can see the hands open, that's very reassuring to me. And this is the baby's mouth and nose. So what I'm looking for, this is the baby's chin, lower lip, upper lip, nostrils, and the tip of the nose. So I'm looking for is to see whether or not I think the baby has a hole in its lip or a cleft lip. And I don't think so. This looks like the tip of the nose, 2 nostrils, and the upper lip right there. So I don't think that your baby has a hole in its lip. Now there can still be a hole in the roof of the mouth, a cleft palate. I can't see that with ultrasound, but I don't see anything that looks like a cleft lip. And this is the baby's heart.
That's so cool.
And I like to look at the heart and make sure that it sits in the middle of the chest cavity and takes up about 1/3 of the chest cavity. Sometimes babies can get a hole in the breathing muscle that separates the chest from the abdomen, and the stomach and intestines can end up in the chest and squish the heart over. That does not appear to be the case for your baby today. Okay. This is one of the 2 views of the heart that I need to see. It's called a 4-chamber view. There's 2 on the bottom and 2 on the top, and they look essentially symmetrical with each other. So this extra little circle right here, this is the lens in the baby's eye. That's what we use to focus near and far. And then when we get old and have to have cataracts replaced, that's what gets replaced. But sometimes babies are born without that lens, so I just want to make sure I can see it. This is going to be the baby's belly button. When babies are about 7 weeks along, we herniate their intestines into the umbilical cord. They grow and rotate, and by 12 weeks, it all gets sucked back inside, and the anterior abdominal wall fuse is closed. So that's proof that that happened correctly for your baby. This is the baby's stomach. Babies practice swallowing and breathing amniotic fluid, so we always have to make sure we see the stomach. Sometimes babies with Down syndrome will have 2 black circles right next to each other, but I only see one where your baby's is, so that's good. And the stomach and the heart are on the same side of the baby, which is the left side of the baby where they belong. So here's the heart, here's the stomach, and the stomach is below.
I'm glad you know what you see.
Exactly. And this is a measurement around the baby's belly. I like to take measurements of the baby's head, belly, and legs to make sure that they're growing appropriately. And you'll see lots of different numbers in the bottom part of the TV screen. We're just going to disregard those until the very end. I'm a trained professional. Don't try this at home.
With lots of years of experience.
Yes. So I'm going to go to the bottom part of the baby now, so if you don't want to know, don't look. And I'll let you know what I was looking at while you were away.
Are you gonna look? You're not a trained professional.
Yeah.
Cervix. So you can look again, these are the baby's feet.
Aw.
So here's one foot here and the other foot right there. The feet are coming off the ankle at a correct angle, they're not clubbed or turned in. They can become clubbed later just because there's no room for them, but today they are not clubbed. There's a little arch in the bottom of the foot. There's a chromosomal disorder called trisomy 18. The bottom of those babies' feet are rounded like the bottom of a rocking chair. And I don't see that. And your baby's hands are open. So here's one hand here and one hand here. That same disorder, those babies' hands are clenched like this with the thumb overriding the fingers. They never open up their hands. So 2 hands and 2 feet. It's good. Your baby has a beautiful bladder and kidneys. And the lower portion of the spine is normal. Okay. And the long leg bones are long and straight. Lots of good news. So this is the baby's head. This is a measurement from the top of the baby's, or I'm sorry, from across, from one ear to the other. Your baby has a nice shape to its skull. Sometimes babies who have holes in their spine, their skulls get pinched in the front and look like a lemon, but your baby's looks just right. There's a region in the baby's brain called the atrium. It's where all the cerebrospinal fluid comes together, and that measures normally. So no water on the baby's brain or hydrocephalus. Little ear.
Does the baby move like around a lot at this point?
Oh yeah.
Because
absolutely.
I feel it kicking, but it's mostly, down here
Yeah.
where it kicks.
No, it moves a lot. It's putting its hand over its ear. Shut up, Leah. Tired of you yammering.
No, we only make nice babies.
It's true. Listen to the baby's heartbeat here. Excellent. So baby heart rate's usually between 120 and 160 beats per minute. So your baby's today is 140, so smack dab in the middle of normal. Oh, it's yawning.
Oh.
It's a little mouth open right
Yeah.
there.
Oh, that's so cool.
A lot of times you'll see them stick their tongue out too. It's pretty funny. So this is a great four-chamber view because you can see both the tricuspid and mitral valve, and they're at the same level of each other. And just a quick look at this baby's spine. I'm looking at the skin edge and these three bones right there. Looks really good going all the way up and down the baby. So I think the spine looks good in all three planes.
Good.
This is the other view of the baby's heart that I need to see. It's called the left ventricular outflow tract, and that's what that's supposed to look like. And I know that's the left side of the heart, Violet, because these are the vertebrae,
Okay.
and this is the left side, and the right ventricle is closest to the chest wall, and it has this little band across here called the moderator band, which is just an ultrasound finding, has nothing to do with anything else. So that's how I know this is the left ventricular outflow tract, and that's what that's supposed to look like. So both views of the baby's heart look normal to me. Okay, now when baby turns into a mammal and starts breathing oxygen, then some heart defects can show up, but the ones we worry about the most, we can usually rule out with those two views. Okay. So we saw the insertion of the umbilical cord into the baby, its belly button, and this is the other end into the placenta, so that's in a good spot. Okay. So both ends of the umbilical cord look like they're supposed to, and the placenta is on the back wall of your uterus and does not cover your cervix. So that's good news. Let's see. There's Shin's umbilical cord. So there's two arteries and one vein. That's the normal complement. Sometimes if there's just one artery and one vein, that can be associated with other birth defects, but your Shin is the right number. And then you can see that little arch a little bit better in that picture of the foot right there. Alright, so I can't even conjure up a marker for Down syndrome. Everything looks really good. So the spine looks good in all three planes. Baby's thrashing around. Looks good. So the last thing I need to see is the cerebellum, which is right here. So this is the back part of the baby's brain. This should measure in millimeters, close to what you are in weeks. And it does. And then there's a space here where the spinal cord leaves the skull, and that measures normally. All right, so all the anatomy in the baby's brain I'm supposed to see, I do, and it looks normal to me. Okay. There's its little face again. Hello. One thing at a time. Look. Very cute. So let's get baby's little report card here. So you're supposed to be 20 weeks and 4 days. I get baby 20 weeks and 4 days.
Oh,
Can't get any better than that. It weighs 12 ounces, so a little coat can floating around in there.
Okay.
And that's in the 36th percentile, so that's perfectly normal. And what's important to me is how the baby's head, belly, and legs are growing, and they're growing proportionately to start.
Okay.
So again, lots of yammering, all good news.
Thanks.
All All right, so if you want to give me just a minute or two, I'll write down what I think the baby is and put it in that card.
Okay.
And then you guys can come down to my office
Okay.
and we'll get the rest of the pictures for you.
All right. Thanks.
Of course.